Sleeping pill. How about that, Randy? I almost called you Randy.
That's okay.
Maybe I took that sleeping pill.
Here.
I took that sleeping pill last night, perhaps.
Did you take Lunesta?
Yeah, it's having an effect on me.
Did it help you doze off?
Yeah.
Yeah, but it might work apparently a bit too well because the FDA recently cut the recommended dosage in half. Dr. Joseph O'Giles with the Clayton Sleep Institute joining us with the reason behind all of this. Good morning to you.
Good morning, Margie.
Yeah, first off, what exactly is Lunesta? What's it supposed to do?
So Lunesta is a pill that helps you get to sleep. It's in a class we call hypnotics, or the technical term is benzodiazepine receptor agonist, BZRAs for our lingo. What it does is it's an engineered drug that has less side effects from drugs like Valium. It does help you get to sleep. It does work quite well.
So now the FDA is cutting the recommended dosage in half?
Correct.
Wow.
The drug comes in 1, 2, and 3 milligram strengths. We had a starting dosage for most patients about 2 milligrams, Margie. What's happened is as they're recalibrating what are the morning side effects, what are the concerns in the morning, if you're on your drug and it's working great, it doesn't affect you at all. But as physicians work with their patients to start an initial dose, especially in a patient who hasn't been on any medication in the past, what was found was that in the morning, some of those patients would have a little more side effects, more sleepiness, and there's concerns about getting up and driving and so forth. So they're recommending starting at 1 milligram instead of 2.
I mean, I assume it's different by each person, but how long did the drug stay in your system?
Well, this drug, there's 2 effects. One is the peak effect, and that peak effect will determine how much lags over later in the day. So the official recommendation for this particular product is that you need to be able to stay in bed for at least 7 hours. But remember, the peak of the drug is going to be, if it's higher, then by the time you get up, the amount of drug still in your system will be somewhat higher. So that's what they're trying to affect here. Lower starting dose, slightly lower peak, less side effects in the morning.
Yeah, I mean, you prescribe sleep aids. I mean, how long should you expect to sleep? I mean, how do you know if you're impaired by your sleep aid?
Sure, that is actually the operative question. What is the idea of impairment? So a couple things. One, you should always discuss, first of all, with your physician, most importantly. Secondly, with whoever is the other person in your household. So am I acting unusually? Any memory impairment? Am I doing things that I don't remember? That we call that antegrade amnesia. So are those things happening? Or do you feel a little bit drunken or a little sleepy? I had a patient yesterday who was telling me that she felt fatigued and sleepy in the morning on her sleep aid, so she wanted to alter that. So those are important things to discuss with your physician.
Yeah, I mean, those are things that you can actually do, is just say, okay, I'm seeing this. I mean, you don't really need the FDA to say. I mean, you can, as the doctor, say, yeah, I think we need to cut back on that or increase it.
Correct. It is on us. You're exactly right, and it's important to have that conversation and that evaluation with your physician. But what they're trying to do here is get people to live by the dictum that we always do, which is start low and go slow.
I think it's a good way to go, personally, for everything. All right, Dr. Joseph O'Giles with the Clayton Sleep Institute. We appreciate it as always. John?